everyone. I heard. Welcome everyone to our Connect session for April 17th, 2025. Amplify your voice, tools and strategies for effective communication on the unregulated drug crisis during the federal election. It's an honor to introduce to you all Elder Susie McPherson-Durendi, who will open with a few words and a drum song in a good way. Welcome, Susie.
Thank you, Antoinette. So good afternoon, everybody, and greetings from the the ancestral territory of Treaty 1. I'm taking the call from Brandon here where I live. So I'd like to start with some words in Cree that I share, a little bit of my own acknowledgement, and then a drum song. Kisemantu, kinanaskimitanan kagisaka, sawenaminan, gamino bimatsia, Ichihinan, ganawinaminan, anos, wabahia igumadahtigisagaw. Wichihinan, ganawinaminan, gakanoninanan, gajawasamasa, nabewak, squesasak, nabesasak, igumagakano wenige apachikuta, anos. Minanan, inanosoin, egomino machihoen. I want to acknowledge the ancestral territory of the Indigenous nations who were and are here on these lands. The 600 plus Indigenous nations that were here across Canada prior to European contact. Unique and distinct societies with their own languages and systems of governance. Living, surviving, and thriving peoples who knew the land, the waters, the skies, the patterns of weather and animals. Who looked after themselves, each other, their communities, and their nations, and who saw themselves as a part of creation and lived as such, always mindful of the generations to come. So we look to the east, the south, the west, and the north. We acknowledge the Indigenous nations across the land and their ancestral story, truth, and wisdom that has carried over time to this day. We acknowledge how the story unfolded over time. And we turn full circle to the east and acknowledge all the nations that now call this land home. Those who came as guests, visitors, settlers, newcomers, immigrants, refugees. We acknowledge all their story too and all that they brought here. We are mindful of each and every one of our stories connected to the Indigenous worldview story that was already happening here. So we give thanks for this day, for this time together, for each one here, for the story of each one of our lives and all that we hold and carry, and the journey that we are on. We give thanks for this opportunity and the purposes that we are gathered here for tonight. And so I say, Egwasane Nenanaskamon, Gachinonawach Maganak. Yes, thank you. I am grateful, all my relations. So I'll sing a welcome song. The welcome song is sung by an elder from Saskatchewan who sings this song every morning to welcome a new day and to welcome the spirit of the directions, the 4 and then 3 more, above, below, and within. The welcome song is a song that I think of as grounding us and centering us to this time together. And also in welcoming the spirit of whatever any one of us needs at this time, whether it's a spirit of hope, of healing, of peace, of courage, of learning and unlearning. And so I'll sing this song for you. Yeah, 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 oh hey, oh hey, yeah, 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 oh hey. Hey ya ya ya, hey ya ya ya, hey ya ya ya, oh hey, oh hey, hey ya ya ya, oh hey, hey ya ya ya, hey ya ya ya, hey ya ya ya, oh hey, oh hey, hey ya ya ya, oh hey. Hey ya ya ya, hey ya ya ya, hey ya ya ya, oh hey, oh hey, hey ya ya ya, oh hey, hey ya ya ya, hey ya ya ya, hey ya ya ya, oh hey, oh hey, hey ya ya ya, oh hey, hey ya ya ya, hey ya ya ya, hey ya ya ya, oh hey, oh hey. Yeah, yeah, yeah. Okay. Yeah, yeah, yeah. Yeah, yeah, yeah. Yeah, yeah, yeah. Oh, hey. Oh, hey. Yeah, yeah, yeah. Oh, hey. Thank you. Thank you, Antoinette.
Thank you, Susie. Thank you for opening us in a good way. And it's my pleasure now to introduce two of our board members, CATIE Upham, who's joining us from the Maritimes, and also Vice President Rebecca Penn, who's also in the Maritime provinces. So welcome, and I hand it over to you.
Thanks so much, Antoinette. Let me just get my slides up for you all. I just want to start off by thanking you, Elder Susie, for opening for us today and being with us this evening, and Antoinette for getting us started today as well, and all the work that you and Shauna and Angela and others have done to make this webinar happen tonight. And also a big shout out to everyone who is here on this call with us tonight. It's a nice opportunity, even if it's virtual, to have us all gathering together on this evening. I recognize that there are a few competing things happening tonight. We've got the debate happening tonight. It's also the eve of a long weekend. So it's great that people are here with us. And I'm really pleased that we're able to also have this session recorded so that others who have missed it can have a look at it later. We wanted to bring this, we've been wanting to hold a meeting like this together for a while. We really wanted to have the opportunity to talk about how we're doing advocacy in a really challenging context. Some things have come together for Mom Stop the Harm over the past couple of months that we'll want to talk about with you all, give you some updates about what's happening with the organization, about the position statements and things like that, and make sure that our members and others who are allied in the advocacy work that we do have access to some good tools and resources. And we pulled this together as quickly as possible, and unfortunately also coinciding with lots of other things happening, but we wanted to make sure we had the opportunity to connect with everyone, share these resources and some updates as we are in this election season. And so I just want to start off by saying thanks to Tracy and Kathy and Chris and Katie for being here this evening. We've got a full evening planned for you, or afternoon for those of you. Sorry, it's gotten dark here in Nova Scotia. And so it's, yeah, feeling like night. But we do have all of us from across the country. So we have a full schedule of things happening for us this evening, or in this meeting. We will start off with having some discussion about the Mom Stop the Harm position statements and our role with advocacy. We'll also have some time with CATIE and CATIE talking about the role of stories and sharing our personal experiences and how that connects and can be used for our advocacy work. We have Chris here with us tonight, Chris from CATIE, who it will be sharing an amazing resource that CATIE has put together, the Anti-Stigma Toolkit, which is chock full of resources to support us in our work. When we all leave together tonight, what we'll have is a number of resources that we hope that you will find helpful. We've put together advocacy toolkit specific to Mom Stop the Harm work. And yeah, looking forward to sharing that with you. So to get us started, I'm going to pass you over to Tracy Letts, the chair of the board of directors for Mom Stop the Harm. Tracy, I'll let you introduce yourself and take it from there.
Thank you, Rebecca. Hi, everyone. My name's Tracy, and I'm the chair of the organization and have been in this position for about 18 months now. And it's really nice to see so many people joining us this evening, and a lot of appreciation to all of you that worked so hard behind the scenes to get this to where we're at today. I think what we're going to just kind of really look at and recap is what our mission is. And that's something that Mom Stop the Harm, all the work that we do stems from our mission and our mandate, which is to advocate to end substance use related stigma, harms, and death. And within that, we've developed some goals and some values. All of these can also be found on our website. Some of our main goals that we have is, looking to achieve equity in healthcare for people that use drugs, evidence-based harm. I'm having a hard time here. Evidence-based drug policies, accessible spectrum of person-directed substances, use health care options, support family and friends of people that use drugs and those mourning the loss of the loved ones. We ensure access to all evidence-based treatment options and multiple pathways for recovery as defined by the person. But one of the main drivers of what we do is that we believe that people are experts in their own lives, and that we are there to help and support and walk a path, but not to make decisions for others. And over last year in 2024, we did come up as a group with some key position statements as well. And one of the biggest ones being that Mom Stop the Harm believes that prohibition is the primary driver for the volatility of the unregulated drug supply. And as an organization, we advocate for a regulated, safe supply for all people who use drugs. We also believe that treatment, we do not believe in involuntary or forced. I'm really struggling with talking tonight. Sorry, guys. We do not believe in involuntary or any type of forced substance use treatment. We do not believe it is compassionate. And we do believe that it can cause serious harm and even death. We support both medicalized and non-medicalized models of safer supply or a regulated drug supply among the tools to stop deaths caused by the unregulated, toxic, safe drug supply. Harm reduction is not in opposition with based forms of recovery. Oh my goodness. I think I'm reading from an old. Harm reduction is inclusive of abstinence and is a tool for well-being. Mom Stop the Harm believes that people who use drugs are experts in their own lives, which I had mentioned earlier, and it is up to them to define what recovery means to them. And Mom Stop the Harm honors and affirms the voices of people who use or have used drugs as experts. We have a duty to make sure that they are meaningfully represented as decision-making tables. The people who use drugs must be involved in designing, implementing, and evaluating programs and policies that serve them. And lastly, Mom Stop the Harm calls for the decriminalization of people who use drugs. And those were the position statements that we came up with in 2024. And using them, these are what going to help guide us and guide what we do moving forward. And a copy of those are available on our website as well in a printable format for everybody. Okay. And next, something that's come up with us too is some pretty big news with Mom Stop the Harm. We are now a registered charity. And, you know, for us, this has been pretty exciting and long overdue. We've been working on this since about, I'd say it's been about approximately 3 years. So it's not an easy process to get here, but we're pretty excited. And the one thing concern we did have about this though is how would it affect our advocacy work? And basically what we found out is that we can still continue to do advocacy. It's a big milestone for us to receive this charitable status because it opens, can we maybe slip up to the next slide? Yeah. Okay, sorry, I'm just really lost here. So for us at Mom Stop the Harm, this is a huge milestone. For us, it opens doors to new funding. It really allows us to go for more grants that require charitable status. It lessens our dependency on government funding, and it lends legitimacy and credibility to us for donations that we may not have gotten in the past. And it really kind of it lends that credibility in just so many ways. I'm sorry, I'm really not doing great here. And most importantly, it honestly shows that Mom Stop the Harm and the work that we do in supporting families, advocating for change, education is really seen by the government and those in that positions of power as what we're doing is good and is worthy of that charitable support. Because one thing we have been told by government in the past is, you know, Mom Stop the Harm is absolutely doing the work that government can't. And we're reaching people that they would be overlooked or bypassed in so many ways. And the work we're doing is so important. And it's really nice to see that we do have the support of government to be able to continue in this path and doing this work. There's a couple of things when it comes to this. So advocacy, really, what does that mean to us? It means to us it's an activity to bring about change. And, you know, whether that's change in policy, it's change in practice and how things are done. It's how do we help implement best practices and things that are already ongoing. But it's one of the main things, and what we're going to be talking about here tonight is how do we change public attitudes. And so advocacy for Mom Stop the Harm has always involved all of those three things. And with charitable status, you know, that was one thing we had always heard is you cannot do advocacy work. But we have found out that is absolutely untrue. Advocacy for us isn't over. We just have to do it a little bit smarter. We can still advocate powerfully and publicly if we just follow a few simple rules that have been put out by the CRA. And things that we can do, you know, we kind of have to stay within the lines of what is being identified to us. But there's tons that we still can continue to do. We can continue what we do. Some of the stuff that we do best, actually, we can educate the public about drug policy, harm reduction, and the unregulated drug crisis. We can share our stories. We can continue to do that. We can share research and data, focusing on the evidence that is out there. We can counter misinformation. And we can share our lived experience. And through our lived experience, we can really work on educating other people. We can continue to meet with decision makers at all levels of government, and we can push for policy change. We can work together, in which another thing that the strength of Stop the Harm is that we can really look at mobilizing people, mobilizing families and supporters to help us with our mandate, to help us move forward with the education, with support, with sharing our stories, with pushing for drug policy changes. And then we can also continue to host forums and panels and webinars such as this one. We can attend in rallies. We can, educate at a level at community events, whether they are farmers markets or we can go to large conferences. We've been to international conferences. We do national conferences. We can continue to do all of that work. So that hasn't changed. There's just a few things that we cannot do. And one of them is we have to maintain our nonpartisanship. But we cannot endorse or oppose any specific political party or candidate. We cannot advise people on how to vote. And we cannot use our resources to support any political party or candidate or campaign. But what we can do is invite them all to the table, have those discussions. And what we'll be sharing with you later tonight is some of the responses that we did get from political parties. We can definitely share information, but we can advocate as one against government if we're not happy with their policies. We can advocate for changes in policies. We can advocate and lobby for what we feel is right and just for people. And we can continue to do that as long as we stay nonpartisan and as long as we just don't tie it to any particular politician or party in general. So the golden rule that we're going to be looking to follow is we're going to focus on the policy or the issue and not the party or the politician. And I think that's a big one. But we can really still continue. We can be radical in so many ways. So we can do what we need to do to get our positions in front of people that can make decisions. And there's a few things that we can do, in advocacy and to say CRA compliant, because they're the ones that are kind of always looking over our shoulder to make sure that we're in our lane, I guess we could say. We really need to stick with being purpose first, and that's to tie all advocacy that we do to Mom Stop the Harm's mission and mandate. And that's something we do quite well. And we just need to continue to do that. We have to stay nonpartisan. I keep coming back to that. We can critique systems and policies as much as we want. We can continue with the letter writing campaigns. We continue with so many things that we already do well. We have to just kind of watch what we do and post carefully on our social media as an organization. As individuals, people can post pretty much anything they want, but Mom Stop the Harm just has to be careful that we're staying in that nonpartisan way that way. So we're going to be looking to keep our content a little bit more neutral during elections particularly, and we're going to avoid commentary on what others are saying. So Mom Stop the Harm, as the official Mom Stop the Harm social media accounts, are probably going to be just more policy focused. It's going to be more about what our key asks are, what is it we want, and we're not going to be engaging in a lot of online commenting on other posts. But as members of Mom Stop the Harm, you are free to do is whatever you would like to in your own social media accounts. That's not something that's tied to us. And I think that's pretty much it. We're going to also be looking at doing more and more online, more training with people within the organization to be able to speak out loud, just share that what our purpose and our peace positions are, to be able to advocate to continue for what our mission is. And we're really going to start keeping records and documenting advocacy activities. So something that we would like to see is if you have things planned like a rally or any type of event like that, we'd really like to have it sent into the organization so that we know what's going on. We can put it on our events page and share that information within the organization and get it out on our social media. Something I just want to caution everybody about too is that when it comes to certain events that are held in Mom Stop the Harm name, if we don't know about them, our insurance doesn't cover them. So that's just something I'd like everybody to kind of keep at the back of their minds. So please let us know if you have things planned and we can see what we can do to support those. You know, one thing that I feel with charity status, it actually gives us more power, not less power, because it's providing us with some set rules and guidelines on how to be more effective and how to work with that effectiveness and kind of maybe hopefully change some of the balance of what we had before. And I think it really kind of helps us do what we do best. And that is to advocate and educate and support and push for life-saving changes. We need to stay bold and make smart decisions and, you know, really tie everything back to our mission. And I think together we can be really successful with that. Especially, you know, this is a tough time right now to be advocating, but I think we need our voices to be strong moving forward. And I think that's pretty much about. Is there more on my slide?
That's everything, Tracy. Thanks.
That's it. Sorry, guys, for sounding so just kind of out to lunch for a bit.
Tracy, you did awesome. Thank you.
Thanks.
I think what's great about some of the work that we are going through right now at Mom Stop the Harm is in terms of figuring out, you know, exactly who's doing what and trying to connect with everybody to make sure that we do have a sense of what's happening and connecting with our ally organizations as well, making sure that our messages are aligned and using similar language, using similar talking points or key messages so that we're amplifying a strong, consistent message across different spaces, across the country, across different organizations. And that's where all of your voices are so important as well. Yeah, and that doesn't mean you have to just say whatever Mom Stop the Harm says or what any other organization. You need to speak from your own perspectives. And you're welcome to draw on the key messages that we'll share with you tonight from both Mom Stop the Harm as well as the key messages that CATIE has put together. And Chris will tell you a bit more about those. And I think as we do that, we'll be, you know, the messages will be stronger. That's how we will change narratives. And it's always you're encouraged to speak on your own behalf, saying what your thoughts are about these things. Okay. I'm really pleased that we have CATIE Moreland here tonight and CATIE Upham. CATIE and CATIE are two people who some of you may already know. I wouldn't be surprised if you had read their names in the news. They are people who frequently speak with media and speak at public events, bringing their lived experiences with them to provide education and advocacy. CATIE and CATIE, I'm going to take us off screen or turn off my screen share so we can see you both. And yeah, I'll invite you to introduce yourselves and chat with us a little bit about your advocacy work. I have a couple of questions that I'd like to ask you both, but I'll let you start with introducing yourselves.
CATIE, do you want to go first?
You're unmuted, so I thought maybe you were going.
Did you say no?
No, sorry. I might as well at this point, sorry.
Yeah.
My name is CATIE Upham. I use she, her pronouns. I live in Salmon River, Nova Scotia, or Mi'kma'ki. I'm on the board of directors of Mom Stop the Harm, and I have experience using drugs. I certainly have many family and friends that use drugs. I'm a substance use health consultant and I am self-employed, and it feels like I share my story and I advocate full time, really. Um, so Mom Stop the Harm fits right in with that. Yeah. Kathy, do you want to introduce yourself?
Sure. My name's Kathy Moreland, and I am a mom, a bereaved mom, and also a retired registered nurse. I live in Windsor, Ontario, the deep south of our dear country, and I became a member of Mom Stop the Harm probably over 4 years ago, after the death of my son, Austin, in June of 2020. He died as a result of fentanyl poisoning. And certainly, although I don't think this was the legacy he had hoped for, Austin's story is very descriptive of what happened, helps people understand that that substance use disorder can happen to anybody in any family, and certainly brings up some of the failings in our healthcare system. So that's become a very big, important part of my life, and how I share his story. And I'm also a very active member of the Registered Nurses Association of Ontario, who are very involved in a lot of work around promoting harm reduction policy, particularly in our province of Ontario. So Rebecca, you have some questions for us, don't you?
I do, I do. And I also know that there are many others on this call. I see other names that I recognize as people who do a lot of speaking and sharing of their stories with the goal of changing hearts and minds and policies, right?
Yeah.
So people can also add things in the chat, and we'll also have an opportunity towards the end of the webinar for others to share about the advocacy that they do and how they use their stories. But we did want to talk with Katie and Kathy, ask some questions here. Like we wanted to ask about how you use your stories to support your advocacy efforts and what makes your stories effective. Maybe you could give an example of a time when you have done some advocacy, shared your story, and felt that it did indeed help move that dial around changing hearts and minds, if not policy.
Katie, do you want to go first, or you want me?
Yeah, no, maybe I will. Thank you for offering. I would say that I share my story in a lot of different ways. I give presentations and workshops on harm reduction, language and stigma, a lot of different things. I've spoken, of course, with media and been on panels and that sort of thing. And I really like to use my story alongside evidence. So I see my story as the heart piece. I notice that grabbing emotion is important. And then the evidence as being that mind connecting the both together. So those two things feel really important. And for me, I would say we had like a round table kind of meeting in Nova Scotia, and I had the honor of facilitating the whole event, and the mayor was there, and so she publicly said that I had changed her mind about some things, and I thought that could be a bit for show, I'll be honest, and she pulled me aside separately and spoke with me about the impact that I had made. And it felt genuine. I mean, I hope that there's change happening. But was really incredible is all of these service providers coming up to me afterwards, thanking me for changing her mind and knowing that them sharing that they had been fighting with, like the council and having them, tearing down encampments and all of this. So that was really, yeah, that was really meaningful to me. It's not always that meaningful, and sometimes it's a challenge, but that those kind of interactions are what really like pushes me forward to continue telling my story and connecting that with policy. So I try not to stay, I've learned over time, too much in the detail because it really re-traumatizes me. And kind of connect it to the bigger picture for sure. Like, for example, like I have experienced an intervention, and that's certainly not forced treatment, but when people are threatening to take all their support from you, I can share, like, I might leave out the fact that I was on Intervention Canada because I do not want people to look that up, honestly. I'll share that in this space, but I can share that and then connect it to what's happening and also connect about how that was harmful to me and the outcome wasn't a positive one for me and connected to what we're seeing around like forced treatment, for example. Yeah, I hope that answers your question.
Yeah. Those are really good examples, Katie. And I think for me, I take any opportunity through the media or through my professional groups to, or anytime there's an opportunity to speak with a politician at any level of government to share the story of what happened to my son and to many of his friends, all under the age of 20 years old. And I think in telling Austin's story of not just his drug use, but what led to his drug use, what we fought for, how we fought to try to help him and support him, the gaps, particularly in youth support and harm reduction, um, and the needs in the community and the different services that failed him, I think has brought about puts a face to the story. And I think, going back to what was said about the mission of Mom Stop the Harm in reducing stigma and helping put a name and a face and a story to the situation so that people don't think of the drug toxicity crisis being just numbers. When you talk about in Ontario, 7 people a day, or in the country, 20 people a day dying as a result of a toxic drug supply, putting the story forward, and trying to do that in a sensitive way, so to make sure that people understand that Austin, my son, was far more than just his drug use, and telling the story of who he was and how it happened and how he succumbed, and how his girlfriend succumbed 2 weeks after him, and how many of his friends who had sat on my porch and been fed sandwiches have gone as well. Helps people understand that these are human beings that are dying, and their family members and brothers and sisters and children. And I think that it's a really important thing. So when you ask how have I seen that change? I think just whittling away at people's the stigma that's been indoctrinated in people probably from the time they were children. And I brought this up in a podcast I just did, where I talked about people having to reflect on where they develop their attitudes about people who use drugs, whether it's through the media or through shows, or if they had a family member that was ostracized as a result of substance use, whether it be alcohol or drugs, and how that's formed their opinion, and still how the media portrays people who use substances as being criminals or weak people or people that should have known better. So I take any opportunity to share Austin's story because I know that's what he would have wanted me to do, so that another mom wouldn't go through what I've gone through, what many of the moms on this call have gone through, and many other family members and friends. So it's like any level of government who will listen, especially around International Overdose Awareness Day. So I find I'm seeking out people to tell the story, to share the story, whether it's at a national level, a provincial level, or local level, For me, it's always like being a pebble in the pond. I don't have to be a tsunami, but if I can create that ripple of understanding, I just will keep dropping those pebbles in the pond. Just keep making those waves. And sometimes they come back and hit you in the face, and sometimes, most of the time, I think it makes people think. I think that's an important part of what we do, is just making people think and rethink and reflect.
Nice. I love that analogy of pebbles in the pond.
Yeah.
Yeah, and just consistent, present, engaged, and yeah, thank you. Thank you. One of the questions we have, and Katie, you sort of touched on this a little bit, was how do you link your personal story to the systemic and social issues that are happening? And Katie, you mentioned evidence. Kathy, you mentioned about the sort of indoctrination or the narratives that we grew up with, the moral the moralistic ideas about substance use and such. Um, any other comments you want to add about how, because I think one of the pieces that is really important is that we do find ways of sharing our stories that will be effective in creating that, like making those linkages to this being a policy issue as well. This isn't an individual problem. This is a policy issue that needs to be changed.
Mhm. I guess I can share that I think by sharing our stories, we give the bigger perspective on what's going on, whether whether someone starts using substances just through experimentation or through a pre sort of being set up for that genetically, or whether it's helping people understand that it's so much bigger than just maybe a choice, that they're talking about trauma and talking about the bigger perspective that helps lead to conversations about what harm reduction really is, and how treatment is part of harm reduction. It's, I guess, the ultimate part of harm reduction would be for people not to use at all, but that's not the reality. So I try to ground people in the story that by telling Austin's story, I can tell others' stories and talk about the fact that this isn't just about people who are homeless, or it's not just about that this isn't just about criminal activity, which are some of the stigmatized visions of people who use substances, that that it's so much more, because that helps to lead to a conversation of what does harm reduction really look like. That and I guess I'll just share the story of one of the things that I have found very effective is, many of you who are in Ontario, and if you're in Alberta, you know that the anything to do with safe consumption sites or consumption treatment services has been stopped, and much to our dismay. But the same thing with legalized supply that happened in British Columbia, where people think that, okay, so we tried this one thing and it didn't work. We still have deaths going on and we're enabling drug use, etc. And I try to explain to people, I said, what we're trying to do with drug policy right now is like trying to bake a cake and saying, okay, so I put eggs in the bowl. Look, there's no cake. And so they take the eggs away and then they throw flour in it and they go, look, flour didn't work. See, we told you we couldn't make a cake. And they don't understand that you have to do an integrated approach, that it has to be all of these things, not just one thing at a time. So putting safe supply in place isn't going to make deaths stop. Putting safe consumption sites in place isn't going to make the deaths stop. So we have to add, like, people need a living wage, people need homes to live in, people need jobs to go to, people need prevention of trauma from the very beginning. We need mental health services that are available to people so that they don't feel they have to self-medicate. So telling our personal stories, and Katie, certainly correct me if I'm wrong, telling our personal stories helps show those gaps and helps people, leads to that conversation of the bigger harm reduction picture and what it really is going to take in order for less lives to be lost. And it doesn't mean we're going to stop losing all lives, because even if we have a safe supply, We know that there will still be deaths associated with opioids or those mixtures of drugs that are out there. Because even though alcohol was legalized maybe almost 100 years ago, we still have deaths occurring from alcohol. But it just, people, it just leads to more conversation. And that's what I talk about, that ripple effect and the pebbles in the pond, is that you start that conversation. It's not threatening, it's not accusatory, and it leads to helping educate people around what harm reduction really looks like and how we're going to save lives and respect lives.
That's great. Thanks, Kathy. We also wanted to bring up the topic of how sharing your stories over and over again, talking about your personal lived experience, has some risks involved, personal risks, privacy of the people that you love as well. How do you take care of yourself? How do you protect yourself? How do you avoid? Katie, you brought up about how it can be re-traumatizing. How do you take care of yourself and your privacy while also sharing? What tips and tricks can you share with the group tonight?
Yeah, if I could start, I have a lot of thoughts about this. I feel like I've learned the hard way. At first, I was like just telling everybody and letting everything hang out, and I'm more reserved now to protect myself and others. I ask about things like who will be in the audience? Will this be recorded? I want to know if I'm going to show up to an event and there's going to be police there so that I can prepare myself. I've had really upsetting experiences. I'm sure many people have. I need to ask myself, is it worth it? In certain situations, also about like what topic things have changed for me in terms of like talking about prescribed alternatives and stuff. Like I feel concerned if I share that my doctor, it's a small area, my doctor could be targeted. So in news stories on certain topics, I might ask for anonymity, ask to be like sent, what I have shared so I can check it. I've asked podcasts to like send me the clip beforehand before posting. I have used Rebecca. Actually, I had a story I really felt could be meaningful for a group of nurses, but it was really a really, stigmatizing, traumatizing experience. And so I wrote it out and I asked Rebecca to read it for me. Yeah, and I like to check with others, of course. Usually I don't use their name if I'm going to share part of their story could be useful, illustrative, and ask them first, of course. That's quite a bit. I'm trying to think. So many things, I guess. I it's hard. It feels like it's becoming more and more unsafe to be a person who uses or has used drugs. So I feel a little bit more guarded. I think a support system is really important. I have folks on speed dial that I can debrief with if things go sideways. Many are here today, and I feel like without them, I'd be in trouble. Certainly.
Wow.
Yeah, that's really, really a meaningful thing to have. We can't do it alone. Yeah, and like I said, I think what I have learned that's been really important is it's not the nitty-gritty details that can make it impactful. Like some of the traumatizing stuff that I thought was really relevant, I realized that I can still make a really impactful point without, getting right down into the trauma. And if folks are wanting this kind of, I almost call it like trauma porn from me, like that's a kind of a bit of a warning to me as well. So I know that my experience is a little different, so I hope that some of it resonates with family here too, about how I try to share safely. Yeah.
Thanks, Katie. That's, yeah, very useful things. I also think about the time where you chose to pre-record something instead of doing it live, so that you had full control over how it went. Nerves wouldn't be wouldn't get in the way and that kind of thing. Kathy, one quick comment would you like to add? We need to move on to Chris.
I think I want to just acknowledge Katie and the experiences she goes through. For me, reliving the trauma of Austin's drug use, because it was pretty scary that the things he was doing prior to his death, and reliving his death. I find after I do an interview, my jaw is pretty tight all the time, and I realize that grief is not something you get over. I had to really reflect on whether I would continue to tell his story. Um, and I'll comment on the comments you get on stories. But I realized that that was based in the fact that I was worried about being ashamed. And I realize, and I'm very clear that I am not ashamed of my son or his life. And so while I still have to kind of relive the story of his death and kind of revisit that whenever I tell his story, I relive that every day anyway. It just becomes a little more, when I'm vocal about it, it just becomes a little more in my body, like I feel it more in my body. The one thing I have to say is that when you do speak to the press, or particularly online media or video, people often say to me, don't read the comments, because I've had comments that, these armchair critics who'll say things like, if you had been a better mother, your son wouldn't have used drugs in the first place. Or if you had been a better mother, your son wouldn't have died. And I have to say that my first reaction to those kinds of comments is upset. Uh, simple as that, is like I'm just appalled. And then I dig down deep and I go, this makes me even more determined to educate people. Like, I'm going, thank you very much for that comment, because now I'm even more determined to educate people and reduce stigma, because it's that kind of comment that is exactly why I put my story out there and why I still fight for my son. So for me, this is how I parent my son still, is because I know that's what he would want me to do. This is how I take care of my son now. I cannot prevent that he died, but I can parent him by being his voice and talking about what could have saved his life. So I think it's just really important that people know that if you put yourself out there, you get really, you might get some ignorant comments made. But for me, those comments turn into a greater determination to educate people. I
That's
just kind of go, thank you for being so ignorant that I want to speak again.
Yeah, that's powerful. I love that. Yeah, that's powerful.
Yeah. So
Amazing. Thank you both. There's a comment in the chat. There's a number of comments thanking you and appreciating you and the work that you do. There's a comment here, Jody. I'm seeing this comment, and we will make this happen. A workshop to talk more about exactly what we're talking about now. Go bigger and deeper into that. So we'll put that on our agenda of things to work on over the next while.
And I'm just going to let you know that I've just added to the chat a link to a project that was just done by Mom Stop the Harm, where a number of us moms shared our stories. And I'm just going to share one other one because it's my colleague who I love and adore. This was done by, I don't say his name, Justin Antoine. And he did some beautiful photography for us, and I can't thank him enough. And these are examples of how um, you can get involved and put a face to the crisis that's going on.
There's so many different ways of telling stories, and I think that's the other piece as well.
Mhm.
There's a number of projects that Mom Stop the Harm members have spearheaded that have been very powerful, including the one you're talking about here, Kathy. There was
Yeah.
also the Jackie Dive's work in the Globe a couple of weeks ago. That was really powerful. Both of these are using photographs that I always think about the purple poppies too, and the purple chairs.
Yeah.
You know, those actions are ways of connecting all of our stories as well. Thank you so much. I am going to move us along because time is a ticket. And Chris is here with us tonight from CATIE. Chris, we've invited you here to share the CATIE Toolkit, but can you start off with introducing yourself and yeah, sharing with us the Toolkit.
Yeah, absolutely. Thanks, everyone. So yeah, thanks to Mom Stop the Harm for having me on today's call. So my name is Chris. I'm the Associate Director of CATIE's Ontario Hepatitis C and Harm Reduction Program. And I'm based in Toronto, which is Treaty 13 territory, the original lands of the Wendat, Anishinaabeg, Haudenosaunee, and Mississaugas of the Credit. So yeah, super happy to be on today's call and share the Anti-Stigma Toolkit with you. Just give me one second. I'm just going to pull up some slides for everyone. Okay. So yeah, so very honored to be here today. Us at CATIE, we're huge fans of Stop the Harm and your work. So yeah, I'm feeling honored to be here, but also very humbled to hear about some of the, the bravery, passion, and compassion of those on the call today. So I'm here today to talk to you about the Anti-Stigma Communications Toolkit. So this toolkit was created by CATIE to help you talk about the impact of harm reduction work with community members, decision makers, partner organizations, and other community stakeholders, as well as also the media. And sort of the angle we're taking with this toolkit is really to help you find common ground and be able to sort of raise the profile of harm reduction work, but as well as be able to respond or counter to concerns about these services as well. So just what I'm hoping to cover today is just a quick overview of the toolkit itself, and then as well as provide a few examples of how the toolkit can be used practically by folks on the call. Hopefully, if I don't run out of time, we'll have some time for questions as well. Okay. So just quickly, who is CATIE? So hopefully some folks might be familiar, but we're Canada's knowledge broker for HIV, hepatitis C, sexual health, and harm reduction. So we primarily are supporting frontline service providers with the latest information, building knowledge and skills, and connecting research to practice. So in Ontario, we have an additional role to provide more in-depth support specifically for harm reduction service providers, which is where some of this work on this toolkit stemmed from. So what is a toolkit? So this toolkit is basically a suite of resources that include things like key messages, talking points, fact sheets, different trainings, and like tip sheets, as well as multimedia resources. There's not one way to use the toolkit, but we designed it sort of as a menu of activities or a menu of tools that can be customized to suit your needs. So based on, your own individual community context, your individual roles and interests, as well as your own capacity to take on the work, that'll dictate exactly how you use this toolkit. So I guess I just want to share that there's no wrong way to do this, but really we're just hoping to provide a bit of a starting point for folks to do this work. So who's this toolkit for? So I want to emphasize this toolkit is for anyone. It was originally designed for people working in community health organizations. The need where it sort of emerged from was that a lot of harm reduction organizations and other community health organizations working with folks who use drugs were ending up becoming the sort of de facto voices defending harm reduction services in their communities. While, many of them being service providers, they were not inherently like working in advocacy or working as communicators, but just sort of found themselves doing this in community. So part of the point of this toolkit was to give folks consistent curated messaging and to make sure everyone is sort of singing from the same song sheet, so to speak, by also integrating some proven and evidence-based communication practices. Our goal is really try to make people who are not inherently in communication roles better communicators. So for those of you on the call, I know some of you are giving like more formal presentations or more doing media interviews. And so there's tools in there for you too. But we know many of you are also just talking like day to day for folks in your community, having more informal conversations. And so we also have things in here for you as well. My one sort of caveat is this toolkit was originally designed for Ontario. So some of the language and statistics are specific to Ontario. However, all the tools can definitely be adapted for other provinces and territories. And most items are available in both in English and French. Okay, so just quickly how the toolkit was developed. So we partnered with a leading public relations and communications firm. So they helped us guide us through the process, including doing a number of consultations, bring some media expertise, and helping us build out the actual resources themselves. The toolkit was created in consultation with a number of people from community. So this includes folks with lived experience, service providers, even a few policymakers and folks working in public health. So this was done through like a number of like surveys as well as key informant interviews to help us understand sort of the needs for this toolkit. Specifically, we worked with a network of 2 harm reduction and hepatitis C workers that CATIE specifically supports in Ontario. So, overall, there was more than 50 organizations involved or who had input in some way in this toolkit. So before we get into the actual toolkit, I want to cover some of the public opinion and audience testing research that we undertook to develop this toolkit. This was done to really sort of inform the overall approach. And I think it will help you sort of understand where we're coming from with the key messages, because I think they may look a little bit different than what folks may initially be expecting from an advocacy toolkit. So here's a quick preview of the sort of key messages. So the key messages are really at the core of the toolkit. You can really think of these as sort of the key talking points that you're going to base any of your other communication activities around. So first off, our sort of like thesis statement, so to speak, is really communicating the need for harm reduction services. So substance use is a reality. We're in the midst of a toxic drug crisis and a drug overdose crisis. We really need more opportunities to keep people safe and healthy and not less. So really establishing that need. And so the next ones you can sort of think of the support points for why these services work. So first off, these harm reduction services reduce the burden on our strained healthcare system. So this includes reducing the burden on emergency rooms, paramedics, and hospitals. They're proven to save lives. So this includes reducing overdoses, prevention of HIV and hepatitis C. And they also link people to other types of healthcare, which can include substance use treatment if that's what folks are looking for. Third, they enhance safety and community well-being. So they provide a place to go for people to go. They reduce public drug use. They reduce discarded needles, and they do not lead to an increase in crime. And then lastly, these services recognize the complexity of substance use. So a lot of popular discourse has sort of pinned harm reduction against treatment, but when in fact we know that this is just simply like a spectrum of services. Sort of the example before, like making a cake, you need all the pieces of the cake to make it work. And that, the whole point is we're providing services for people that they need both in the moment, but we can connect them to other services when they're ready. So just sort of keep these key messages in mind as we go through the research, and I'll come back to these afterwards. So last fall, our consultants delivered a survey to 1,250 Ontario adults in last November. So this was delivered by Leger, which I think is a well-known public opinion research group. You'll hear them also doing like election type polls and that sort of thing. So we gathered a weighted sample of respondents that were representative of the Ontario population, so by age, gender, geography, etc. And our goal is really understand people's viewpoints on harm reduction services in Ontario and how compelling various arguments are in addressing them. So what we found was actually both surprising on the surface, but actually not that surprising. So most people in Ontario actually support harm reduction programs and services. And not only that, but the support outweighs opposition by nearly 2 to 1. So nearly twice as many people support harm reduction than oppose it. I know this can sound kind of probably very surprising based on a lot of things we hear in the news and from politicians, that sort of thing. But this was consistent across demographics like gender, region, age. And just a few months ago, we actually ran the survey again, but this time nationally. And guess what? We saw pretty much the same thing across Canada. Even in places like Alberta, no offense to the Albertans on the call, but even in Alberta, it was still more or less a 2 to 1 ratio of people who just support or oppose. And then if we go to Quebec or the Atlantic, it's actually more like a 4 to 1 or a 5 to 1 ratio, which is really incredible. So what does this tell us? So although it doesn't always feel like it, actually the detractors for harm reduction are actually quite a small vocal minority. And where actually most people fall in are sort of somewhere in the middle. I think there's a lot of people who very quietly support harm reduction, but they're not necessarily outspoken about it, or it's not necessarily front of mind for them, but they are not, like opposed to it. So let's dig a little bit deeper. So we're going back to, this is Ontario specific results now. I might not go through all of these, but we asked people some true, false, or kind of like agree, disagree type scale questions to assess their attitudes and beliefs on specific aspects of substance use. So like generally, I think people who supported harm reduction programs like understood the sort of more like holistic approach of harm reduction in terms of like, and understood as healthcare, and also understood the sort of like reducing harms piece of it. But for people who opposed harm reduction programs, I think a lot of this, like a lot of these are somewhat pragmatic concerns. A lot of it's rooted in misinformation. However, weren't a lot of necessary results like being people's like, oh, I hate harm reduction or I hate people who use drugs. It wasn't like inherent like issues. It was actually more, pragmatic things where people are worried about like safety, property values, economics, misuse health resources, which are legitimate concerns, but perhaps rooted in some misinformation. So the thing to sort of take away from this is that, again, although it can feel like it, it's not always just an uphill battle. There actually are a lot of allies, or at least people who are sort of on the fence. And I think a lot of this is reinforcing these attitudes that people already have. People are, I'd like to think inherently compassionate and inherently care about the well-being of their society. And so it's just reminding people that harm reduction is part of this. A lot of this toolkit was also based on this concept of what we're calling a movable middle. So on a lot of contentious issues, actually a big chunk of people actually exist somewhere in the middle, and they can sort of be convinced either way. And they're not like, there's going to be the people who are absolutely in opposition, but actually those people we're not really trying to target here. We're trying to sort of move the bell curve as opposed to capturing the people who are kind of most opposed. So that brings us back to our key messages. So we created these messages based on the public opinion research. And again, really tried to hit those topics that are most salient or relevant for everyday people. So things like healthcare access, the economic arguments, the public safety arguments, and as well as, addressing that there is access to treatment as part of this as well. And I guess what I just want to acknowledge is that, I know in this sort of advocacy work, we can often, this might sound different than what you're used to hearing. And we did this in a very intentional way to bridge the gap to the opposition. We know some of this language might feel a bit soft, so to speak. And while we certainly recognize there's a time and a place for angry and more radical activism, we know that many of you in the room also have to walk a fine line. And so this is specifically created to help, to sort of help you find the common ground in the conversations. Okay. So that was the background. So I'm going to quickly dive into what's actually in the toolkit itself. And I thought the best way to do that, I can't show you everything, but I thought I would run through sort of 3 example scenarios. So the first one is talking with a skeptical community stakeholder. The second one is talking to the media. And then lastly is talking to policy or decision makers. So I'm just going to quickly do a new screen share. Okay. So this is the homepage, which you can access at antistigma.ca. You can see there's a menu up here, or you can also just scroll down. We've sort of divided some of the resources into, I'm new to this work. I want just like sort of the basics, like the key messages and some of the talking points. There's an I am experience section, which has a bit more of, I guess, the advanced skills, like and like some of the more specific use case resources as well. Or you can click here, which is just, I just need resources, and we just show you everything, and you can sort of know what you're here for. So click through the resource page. The first thing I'll show you is the talking points and key messages. I won't go through this because I already showed you them on the slide, but just to get you familiar with this. So as mentioned, the key messages are the key talking points that you want your audience to hear and remember. These are the core aspects of your story or the narrative that you're trying to share through any of your communications. The way it's structured is like, so there's four main key messages, or sorry, I think it's five main key messages. And then under each there's a number of supporting points. And so again, you can use this a bit like a menu. So you create your main sort of a key message, and then you can sort of pick and choose some supporting statements to support that key message. So for an example is community, or writing. So community-based health services for people who use substances can enhance safety and community well-being. And so you can go down and then, so for example, you can support that with supervised consumption services in Ontario, made over 533,000 referrals to other health, social, and substance use services. So you can use as a bit of like a menu to like craft like sort of a customized message. Messages like this one. So again, I mentioned these are mostly Ontario specific stats, but where you have them, so if you have region specific or even community specific stats, feel free to swap those in if you have them. If you think you're going to have a kind of more brief or like fleeting conversation with someone, you can also look at the elevator pitch. So this is the same information, but it's just in a very like bite-sized format. So I know the key messages document is quite long. That's sort of everything. This is like the quick Coles notes, something you can tell someone in about 30 seconds. And similarly, there's also a fact sheet that has all of the key messages as well. So this is kind of in between the full talking points document and the elevator pitch document. And so this has everything on one page. So this is a bit more easily digestible, and particularly is good if you want to, share a handout with someone or have something posted on like a bulletin board or something like that. Okay, so those were the key messages. Again, those are really the sort of the core of the toolkit. We can walk through the few examples now. So the first one is meeting with a skeptical community stakeholder. So again, this could be an example of like, perhaps like a abstinence-based program or shelter, concerned business owner, disgruntled community member, or even like a faith-based organization. So a good tool here would be the Difficult Conversations Guide. So this guide provides practical tips and strategies on how to engage with audiences and stakeholders, particularly where it's uncomfortable or contentious, perhaps due to major misalignments in views or lots of heavy emotions involved, or disagreement in viewpoints. So this guide tries to reframe this to help you find the comfort in the discomfort, so to speak, and find that common ground during conversations. So it walks you through a few steps. So this includes before you've even had the conversation, like how you're going to approach it, whether the conversation is worth having, determining what your own goals and values are, and making sure you're sticking with that through the conversation itself. And then also to how you're going to participate in the actual conversation itself. So, first off, how can you be an active listener? And how can you, be present and like accept and hear others and make space for them? But at the same time, when it's the right time, being able to, oh, sorry, I think I passed it, sort of like take up space and be able to share that information, sort of become an educator as well. So an example of that is there's this acronym here called ABE. So it's Acknowledge, Bridge, and Educate. So this is sort of the gentle, compassionate way of, make sure you're listening and being present and acknowledging a person's views and feelings. But then this is sort of like the move to sort of be able to bridge into that role where then you can sort of share information, and you can sort of do that education as well. So an example would be, using the acknowledgement, and then what's key here is using this sort of like bridging statement. So there's a few examples here. So for example, you might be saying something like, while I understand it can make you feel unsafe and make you feel angry that there's a harm reduction site in your community. And then that's the bridging statement. And then you can say, however, actually, we have the same goals. And this is where you get into the education part. And this is where the key messages come in. So actually, we have the same goals. Research shows us that harm reduction services can actually reduce public drug use and discard equipment. And we're actually both interested in keeping our communities safer. Okay, so that's the Difficult Conversations Guide. The next thing I'm going to look at is an example of doing a media interview. So you can click here so to access the media training. This will bring you through to a different CATIE website where the training actually lives. You'll need to create an account first. It's pretty simple to sign up. There is a small lag time because we just do have to like approve them on our side, basically just to make sure that like you're not like Adam Zivo or something trying to access our media training. So it just might take a bit delay to access the training. But once you're here, you'll see 3 trainings. So we'll click on this one, the media training, and it's a 5-part video module. And so it'll walk you through practical steps on how to work with media, what are journalists interested in, how to answer questions in an interview, and like make sure that you're getting your point across. The session is presented by Beatrice Pulte, who's actually a former TV and print journalist. Those who might be, some of you might recognize Beatrice as actually a former anchor on Global News, so has very, very strong credentials in the media. So that's the video training. So that's a 5-part piece, but there's also a shorter media training tip sheet. Where's it here? Tip sheet. So this is kind of like the highlights, like the Coles notes of what's in the actual training. So this is good if you just need to like a quick refresher, like maybe you have an interview coming up and just want to quickly run through some of the skills again. So I won't go through everything, but an example of something that's in this toolkit is these bridging statements. So this was similar to what we talked about in the Making Your Case toolkit, but this is sort of something to have in your pocket as like a responsive way to respond to sort of like if a journalist throws you like a weird curveball or is trying to like elicit a certain response to get like that soundbite. A journalist's job is to get those sort of like contentious or get the clicks on a story. So they may try to throw you a bit of this curveball. So for example, if you're getting interviewed and a journalist says something like, but shouldn't we be focused on stopping drug use and forcing people to get in treatment instead? They might be trying to bait you into an argument and then getting a soundbite that, says like, Mom, stop the harms, like opposed to treatment, which we know is not true. So instead, you can choose one of these bridging phrases. So for example, we have to take a step back. 21 people die every day in Canada, and we need a way to keep people safe and alive, and harm reduction services do just that. Another example is you could say like, I can't speak to that, but what we're focused on is keeping people alive during a toxic drug crisis, and harm reduction services can do that while also becoming a pathway for people to seek treatment. So having a couple of these points, having these in your back pocket really it sort of bookends your statement, and like it also prevents the journalist from perhaps like misquoting you or chopping off like the first half of what you're saying. And again, can help you sort of maintain control of an interview to make sure that you're only saying what you want to say and not what perhaps the journalist wants you to say. Okay, sorry, I think I'm running a bit over time now. I'll show you one more last quick thing. So the last, or actually, I'll show you this quickly as well. So this is still related to the media toolkit, or sorry, the media training. So we also have a photo gallery of sort of like stock images around harm reduction. So these photos are free for both media outlets and community organizations to use. A lot of feedback we got is that media often gets it wrong when they're trying to print a photo along with the news story. I'm sure we've all seen the news article that has like the syringe like in a dark alley, or like a picture of like someone like sleeping outside or something like that. So, we undertook a photo shoot at a harm reduction site in Toronto to develop this little stock image library. And our real goal here was to portray harm reduction as a professional, like warm, comforting, like clean health service. And so, a lot of media outlets, they're actually kind of lazy with how they find photos. Often they just pull what's in like the archive, and they just want whatever's fast and convenient. So feel free to, when you're getting interviewed, you can point them towards here, and all of these photos can be used by media outlets. Okay, the one last scenario I'll go through. Rebecca, am I okay for time? I can also cut off here.
Yeah, I'd like you to show, yeah, I think I know where you're going, so please continue.
Okay. The one last thing I was going to talk about, and I'll try to do it quickly, is talking to decision makers or policymakers. So we have something called the Make Your Case tip sheet. So this tip sheet walks through a few steps around making your case to decision makers. So for example, like one of the things is really understanding this concept around like spheres of influence. So, for example, if you're trying to reach a politician, you may not be able to get that meeting with that city councilor right away, but understanding that, they have people around them who are also influential. So, you might try and reach some of their like policy staff who work in that department. You might try and pick up on opinion leaders like the media or like, a prominent physician or a labor union or something that's in your community. And so through these more like indirect means, you may still be able to influence that policymaker, even if you can't get that direct meeting with them. Another quick thing just on language is I think understanding what policymakers care about. So oftentimes we may try to lead with things like saying like harm reduction it's the right thing to do. Overdoses are a big issue. And these kind of larger, broad, more subjective statements can sometimes be not as compelling for decision makers. They get inundated with requests and concerns all the time. But if you can spin it to provide that more direct outcome or ulterior benefit, this can be sometimes more compelling. So, for example, if you say harm reduction services respond to, like X thousand number of overdoses in our community each year. This diverts responses from going to emergency rooms. It reduces wait times for emergency departments and reduces wait times for 911 calls. Sometimes this can be the more compelling approach when you're talking to a policymaker and really understanding what's important for them. Okay, that was my last example. I'll leave it at that. Sorry, I think I've gone a bit over time. But yeah, I'm happy to answer questions, or I'll pop my email in the chat and feel free to get in touch with me if you have any questions.
That would be great. Thank you so much, Chris. There's so many comments in the chat saying this is fantastic and what a valuable resource. Absolutely. We did try to do too much in this webinar, and we all thought it and felt it, but just wanted to, we couldn't not. So apologies for trying to do so much in one spot. I do love having opportunities to connect and have conversations about this in other ways. So if there are opportunities, people can always reach out to us through the Mom Stop the Harm website. I'd like to show you one more thing, and then I'm going to pass it back to Antoinette to close for us tonight. But I did want to share with you that we do have a resource kit that we've put together at Mom Stop the Harm. And I will share that in the chat. I will share that in the chat as Antoinette says, as I pass it over to Antoinette. Sorry, I'm terrible at doing two things at once. Oh, Katie, you were going to say something?
I wanted to note in that kit, there's also a link to a blog post by Mom Stop the Harm. So we reached out to all the federal parties on their responses to key issues that we care about. So not everyone responded, but we did copy those responses verbatim, and we just thought that that information would be useful for folks with the upcoming election. Yeah. I can find the link to the blog post too, so that specific link. Yeah.
Yes. So there we do. Thank you so much for remembering about that, Katie. I'm sorry, everyone. We do have that up on our website, as you say, and we'll post it in the chat in one moment, or you can use the QR code there as well. Big thanks to CATIE for being here to talk with us and share your experiences with us, CATIE. And Tracy, thanks so much for taking us through the values, mission statements, positions, and how we're going to take care of the organization, take care of the work, take care of each other, and also keep moving that advocacy forward while doing what we need to do for CRA as well as a charity. And Chris, big thanks for being here to talk to us about the toolkit and walk us through and share that. Katie, thanks so much for all your help and work with this as well. And Antoinette, thank you and everyone else for joining us tonight. Thanks so much for taking the time. And Antoinette, I'll let you say any final. Antoinette's like, am I supposed to pass it back to you, Antoinette? I couldn't remember.
I could just say a couple of things.
Thank
Just
you.
thank you everybody for being here tonight. Tons and tons of very important information for all of us. And I'm sure with all of the links and all of the things, everybody can take a deeper dive into it. When we send this and post this on our YouTube channel, take some time and to kind of go into it a little bit deeper, the toolkits, all of the information. I really love how we connected heart and head. There was a lot of information and there was a lot of, personal heart sharing story. And I think that's probably one of the biggest things is how do we do that for people? How do we connect people's hearts and head? Because they say that's the longest road is between the head and the heart. So I just wanted to, again, thank everybody for being here tonight. Tracy, I saw you put your hand up. Did you have something else that you wanted to share before we call it a night?
Sorry, I had to step away for a moment, but I just want to remind everybody about our AGM. Is coming up on May 31st. Registration link is on our website, and it would be great if everybody could join us there. Lisa Lapointe is our keynote speaker, and I think she's just going to be absolutely fabulous.
Thanks, Tracy. Thanks, Tracy. And if again, I'll just reiterate that our YouTube channel, we have some past sessions on there. This one will be on there, and we have some future ones in the works. And I also noticed in the chat there was some ideas there. I believe Tracy popped in there. If you have those ideas so we can capture them, please email info@momstoptheharm.com so that we will be able to put together some kind of a plan or organization with that. So collectively, that's how we make change. We bring our voices together and collectively. So thanks everybody for being here tonight, and have a fantastic long weekend. Take care.